Today I will be presenting on the topic
Just a minute. Now you can start.
to assess the efficacy of moisture chamber goggles in the prevention of exposure keratopathy in patients in the intensive care unit. No financial disclosure and ethical clearance is obtained. And coming to the introduction, exposure keratopathy is damage to the cornea that occurs due to the prolonged exposure of the ocular surface to the outside environment, and it can lead to ulceration, microbial keratitis, and permanent visual loss from scarring. And several factors help maintain tear film intact, which like intact blink reflex, normal blink rate, complete eyelid closure during sleep and blinking. And in critically ill patients, these protective mechanisms are challenged. These are some of the ocular conditions seen in the ICU, and lack of timely intervention may lead to the conditions like corneal ulcer and even blindness. Purpose of this study is comparing efficacy of using combination of ocular lubricants and lid taping with the use of moisture chamber goggles to prevent exposure keratopathy. This is the literature review where some of the articles said that moisture chamber goggles are efficient than the lid taping group. And coming to the methodology, it is a randomized control trial done at MS Ramaya Medical College and Hospital during the period of November 2023 to July 2024. And 62 sample size were taken, where 31 were cases and 31 were controls. And moisture chamber goggles, materials used for moisture chamber goggles, lubricating eye drops, micropore tape. AC vent and the position of the bed was also considered to monitor the atmospheric conditions. And the atmospheric conditions across all the beds was titled to be similar. Comatose patients with reduced blink reflex, patients of muscle relaxants, and mechanically ventilated patients with low GCS score, and the patients in ICU for at least 24 hours are included. And eye treatment with topical agents other than the lubricants, and patients with pre-existing trauma or inflammation to the eye were excluded. Coming to the procedure, 62 patients were grouped to two groups, one receiving lubricants and lid taping labeled as open chamber, and the other with goggles labeled as closed chamber. And detailed eye examination was done, like lagophthalmos, Bell's phenomenon, blink rate, pupillary reactions, corneal changes using 1% fluorescein under cobalt blue filter in direct ophthalmoscope. Corneal staining was done and graded, and cases and controls are followed up till they are out of intensive care unit. And two groups are compared with respect to conjunctival injection corneal staining, and data analysis is done using SPSS data, and results are documented. These are some of the pictures where we have put moisture chamber goggles. In the first picture, you can see the humid environment which is created. And these are the corneal staining pictures. And coming to the results, age and sex matching was done, where predominantly males were more, and 89% majority were 50 to 90 years of age group. Coming to the results, conjunctival injection, we have compared on day 1, day 3, and also the final day, where final day 29.2% were mild and 14.5% was diffuse in closed chamber and in open chamber, and in closed chamber it was 32.1% mild condition and 17.7% was diffuse condition, where p-value on day 3 was 0.21 and final day 0.24, which is insignificant. And coming to corneal staining, final day it was 84.6% no staining, and some staining was 11.5%, and closed chamber it is 78.8% no staining and some staining was 19.2%, and the final day it was 0.244 p-value, where it is insignificant. And the discussion, in our study the use of moisture chamber goggles were equally effective compared to the open chamber group, and is also considered as less tedious job to the nurses working in the ICU, and instructions given to the staff in the ICU was less time consuming and more efficacious from doctors and nurses point of view. And moisture chamber goggles, they provide a sealed environment around the eyes, maintaining humidity and reduced evaporation, and it helps in enhanced moisture or tear retention, humidity control, protection from irritants, ease of use, and improved healing. And according to these references, only the conducted on nurses, 21% of nurses had good practice, 25.7% had good practice in improving eye care, and 28.9% had fair practice. And according to Khalil et al., 59% felt it was lack of knowledge, where 19% felt it is an important job, not an important job. And according to this study, we have done a study at our center where lack of knowledge accounted for 59% and lack of time was 4%. Too much work was 6% and too much documentation was 19%. Coming to the conclusion, moisture chamber goggles are equally effective in preventing exposure keratopathy and reduces the need for constant intervention and follow-up on correct application, unlike in lid taping. And the ease of use and equal benefits with less effects shows that moisture chamber goggles play an excellent role in preventing exposure keratopathy in critically ill patients where ocular treatment is compromised due to various reasons. These are my references, and thank you. Through their eyes, we have witnessed both fear and the will to fight. And these are the moisture chamber goggles which is used to...
Yes, Dr. Swami, what is the cost of these goggles?
So it is like around 150 to 180 bucks on average.
Rupees, that's all.
Yes.
Thank you, Dr. Shravya.